Fellow panelists, colleagues and partners, Show Me Your Number, a non-profit organization which is part of the Sports, Arts and Culture sector in the Sandton Civil Society Forum, supports the pathogen access and benefit sharing process because it speaks directly to the principles of equity, solidarity and justice in global health. Without equity, solidarity, justice in global health, the world is doomed. South Africa is a global proponent of solidarity, equality and sustainability, as was demonstrated during the G20 South Africa that was hosted in 2025. The stance of South Africa around these themes resulted in the country being forcefully removed from the G20 in the USA that is taking place this year. But we remain resolute that we will not sell our principles just to be accommodated. COVID-19 pandemic exposed deep inequalities in how the world responds to health crises. While pathogens were shared rapidly across borders, the benefits, which are vaccines, diagnostics and treatments, were not shared equitably. Countries in the global south, including South Africa, were often last in line despite being critical contributors to surveillance, science and data. The pandemic agreement, which was delivered on the 5th of May, during the occasion of the 4th World Working Group meeting of the G20 that was held in Melrose, was a turning point. We clapped hands, and in the room we had Ms. Malibona Matsuso, former Director General of the Department of Health, was part and continues to be part of the lead negotiators for the pandemic agreement, and by extension, she has to ensure that the advocacy we're driving of ensuring that the PABS is finally adopted to make the pandemic agreement something worth meaningfully beneficial to the global south, especially countries in Africa. Our obligation not to allow Ms. Malibona Matsuso not to fail. We also have to ensure that the countries in the south are not failed because of what we see being done.
That is the problem with us in South Africa and all of Africa. If you go to Zimbabwe, you go to Rwanda, you go to Uganda, they are not, we only react when something happens. We need to change that narrative. That's the first thing. That's what I'm taking out of what you guys have said here today. The other is, we work in silos, and that is true. No organization wants to partner with the other one to get a collaboration to get everything done the correct way. Ideas are to be shared, and shared ideas gives you more power. But if you work on your own, they work on their own, how do we ultimately present what we have to present because we are divided? So, here in South Africa, we have many organizations, many. And for me, I think the first step, I know you have only a few more days to go, but the ideas that have been touted here today and what has been said should lead to us knowing exactly what it is we need to do as South Africans. And not only as South Africans, we need to look at our external African partners and say, how can we collaborate with them? Because HIV, health equity is across the board. It is not just only here in South Africa. I want to align with, that is the problem with us in South Africa and all of Africa. If you go to Zimbabwe, you go to Rwanda, you go to Uganda, they are not, we only react when something happens. We need to change that narrative. That's the first thing. That's what I'm taking out of what you guys have said here today. The other is, we work in silos, and that is true.
What we aimed at achieving today, I feel we have achieved. We have been able to mobilize civil society, and they are keen to go back to their constituency and also mobilize and teach. And it's a platform for us as an organization to work with this civil society in ensuring that we train and inform, because education is power. Our AHF president says sometimes as Africans we are apologetic. And I think what the speakers have said today is that we have equal negotiation power. We are the ones who are detecting these pathogens, and we are the ones that share with the global community these pathogens. So we should be able to have equal negotiation power. And as our delegates are going into the negotiation table on the 23rd, we are empowering them and also mobilizing all communities and media, and for us going to the embassies to actually nudge them to understand that that negotiation platform is not for the rich, it is for everyone. Because we live in a global community, we are all affected by the same pathogens, by the same pandemics, and if we keep quiet, we are going to inherit a PABS that is not going to be equitable for the global south. And we will be judged by our children, by history. In the coming years, as Comrade said, that we start 5 years, we will be judged.
We are standing here together with the same voice, however with clarity. There are a lot more that we can achieve if we stand together. SADC is committed to ensuring that the African countries derive fair and measurable benefits from the global pathogen sharing systems. We do believe that if Africa has to provide data, it's not just a data provider, but it's also a decision maker. We should be allowed to be able to sit in the seats whereby we are able to make a voice that can change policies, and policies that also are able to match the people within Africa. We have got different dynamics, and within Africa, with all the challenges that we do have, if we are to sit as a decision maker, we'll be able to strengthen our systems and go even further. As a technical support, SADC actually pushes quite a lot more in the health technologies. We can collect data, we can pull a lot more that can be used, and not just regionally or in South Africa, but for the whole of Africa as a unit. And if we have to do that, we have to do it using evidence-based advocacy. We're not just making policies, we're not just saying anything without tangible evidence. If we have evidence, then we are able to bring sustainable solutions to the various challenges that we do have, and ones that we can reflect and actually build upon in the later days.
Of the inequities of the COVID-19 pandemic. I would like to lastly say that if we all do not join hands in the southern region and ensure that we stop the EU, we block the EU from compromising health equity, then we will have ourselves to blame, and the future generations will find us always wanting in the history book. So I advocate that we all stand together and ensure that EU stops blocking health equity. Thank you very much. Of the inequities of the COVID-19 pandemic. I would like to lastly say that if we all do not join hands in the southern region and ensure that we stop the EU, we block the EU from compromising health equity, then we will have ourselves to blame.